and all aspects of HIPAA security and privacy. My name is Adam Bullion. I will be your moderator today and throughout the course of this series. Just by way of some quick housekeeping, our presenters today have agreed to accept comments and questions throughout the course of the presentation, and attendees can do that in two ways. You can raise your hand via the My Mood button, which is at the top of your screen, and that will alert me that you have a question, and I will then unmute you and you can speak directly to the presenter. Otherwise, if you feel so compelled, you can use the chat function, which will come to me, and then I will address that to the presenter as well. So our topic today is risk assessments. What is a risk assessment, how to do a risk assessment, and why risk assessments are important. And we are really honored to have two distinguished presenters for our first webinar, Robert Zimmerman of QIPsolutions and Susan Pretner of KeySys Health. Robert is the managing partner of QIPsolutions, an industry leader in HIPAA compliance. Robert and QIP have developed HIPAA HITECH Express, which is an all-in-one HIPAA risk management and compliance solution. He has over 25 years of experience in IT and is a frequent presenter on HIPAA and health IT security and privacy issues. And thanks for joining us today, Robert.
Thank you.
Susan Pretner is president of KeySys Health, which provides consulting focused on HIPAA and high-tech compliance. She has more than 30 years of experience in the healthcare industry, including extensive software design and development work and health administration information systems. And thank you for joining us, Susan. And at this time, I will turn the floor over to Susan to begin the presentation.
Thank you, Adam. So our big question is, why do a risk assessment? This is one of the major reasons because data breach is lurking around lots of corners. As the former U.S. Attorney General said, if you think compliance is expensive, try non-compliance. In fact, the Office of Civil Rights just settled with two organizations for a combined $1.975 million penalty after unencrypted computers were stolen. One was a company called Concentra that had already identified unencrypted devices as a risk and a critical task to rectify that weakness. But their efforts to fix it were deemed incomplete and inconsistent over time by OCR. The other notice of breach was reported in February of 2012 by an Arkansas health plan. That's over 2 years ago, and it's just now settled. And that's for a laptop stolen out of an employee's car with 148 unencrypted patient records on it. So you can imagine the impact of having OCR or HHS communicating with your organization for 2 years over one incident. According to Susan McAndrew, who is the current Deputy Director of Health Information Privacy at OCR, and I'll quote, "Compliance and enforcement is really where the action is going to be in 2014. So where are you? Where are you in identifying your risks and taking steps to correct deficiencies in compliance with HIPAA, more so to avert a breach? So as you can see from some of the little bullets here, several perspectives seem to be out there. And one, with crossing your fingers that it just won't happen to you, so don't worry about it. The other is, often we're hearing, it's just too complicated, we're just going to take our chances and not do it. And a more difficult one to deal with is management doesn't see this as a priority. You know, why should I push it in my organization? But if you are audited or you have a breach, the first question that you'll be asked is this: have you conducted a thorough risk assessment in the last year? So, why is risk assessment so important? Well, first of all, it sets a baseline for knowing what your privacy and security controls are, even if they're ad hoc. Controls are nothing more than your safeguards for safeguarding protected health information. A good risk assessment should help you prioritize what's needed in terms of remediation. Also, and I think this is very important, it informs management of the gaps in your ability to really secure PHI. So often what you don't measure you can't improve on, and management is often not aware of how few sometimes business processes are really in place in your organization. So it brings that to the fore. It also should establish a roadmap to guide you toward monitoring activities. As you go through risk assessment, you'll start seeing questions that say, and what are you doing to measure the effectiveness of what you've put in? How frequently are you making changes to make it more effective? So it's really a first step toward HIPAA compliance. As we said previously, OCR will look first for a timely and thorough risk assessment. So how do you get your arms around getting an assessment on target? What are some of the first things you want to do? You're looking for a process to initially assess whether you have typical business practices documented and implemented in your organization. So first of all, understand your risks, your risk exposures. So what are really credible risks for your practice? This is going to vary for everybody. So think about what your environment is. Like, is there a lot of criminal activity around your office? Or what's your level of technical sophistication? Are you using a lot of mobile devices? You know, how frequently are you troubled with natural disasters like tornadoes or fires or floods? I'm in Alabama, so that's an everyday affair. And what about accidents or possible loss of key employees, you know, due to illness or death or even job changes? How would that affect you? What are really credible things that are affecting you? And then secondarily, what are your PHI data boundaries? When you see a term like boundaries used in an assessment, we're thinking about every resource, every device that you use to create, store, transmit PHI. So we're talking about your endpoints. Where does PHI come from? Where does it sit? Where is it going? And then identify threats and vulnerabilities. And what's the likelihood that your practice could be harmed by one of these threats being exploited? Okay, for instance, what's the impact of the loss of your EMR system? Or even you lost access to your facility. Would it be severe, even if it was only for 24 or 48 hours? Finally, evaluate the effectiveness of your current standards. You're really going to want to think about what you already have in place. So these are your controls that you're using to answer the requirements for administrative and technical and physical security areas. And they're all required by HIPAA, of course. Now, Robert's going to take over and do a little bit deeper dive into what the risk assessment should contain.
Thank you very much, Susan. What I thought I'd do is just start off with a couple of the myths of security risk analysis, because while the concept hasn't been out there, HIPAA security rule is probably going on 4 years now. Still a lot of people aren't quite sure what they need to do. There's a lot of myths. There's a lot of untruths that have been put out there by just all kinds of people, some by confusion, some just because there's a lack of understanding. So, number one, security risk analysis is not optional for small providers. A lot of small providers feel like, I'm not going to get audited, why should I do it? What I would say is, the reason to do it is not for compliance. The reason to do it is because there are risks out there. You really need to identify the risks that you have within your practice or organization. And quite honestly, patients are starting to ask, are you secure? They're as concerned as everybody now as to what's the security of their information, especially their patient information. If you work in the mental health field, probably more than anywhere, patients are extremely concerned if their information gets out. So there could really be a hit on your reputation. So no matter what the size of your organization, you need to do a risk analysis. Many people also ask, I've got an EHR in place, electronic health record system. I assume my vendor did everything. No, vendors make claims and they love to say their solution is HIPAA compliant, but it doesn't mean your organization is, or that you don't have any risk in place, as Susan mentioned. So just because you have a EHR doesn't mean you're secure, and you do need to perform a risk assessment. And then the last one that I'll just add, because there's a whole series, but one of the real values of this is when you look at the meaningful use requirements, the HIPAA security rule requirements, they both require the performance of a risk assessment. If you're interested in doing some of the other things and getting involved in an ACO or potentially a patient-centered medical clinic, requirements and certifications mention the security and have you done a risk assessment. So there's a lot of value as we go forward into completing a risk assessment, one for compliance, but I'd say more importantly for the security of your own practice, your reputation, revenue, etc. So when you look at this here, what does a risk assessment contain? The first part of it really is the data collection. So you want to see where have you done anything in the past. Most organizations have done a little bit of risk assessment, but they don't have anything formal, and that's one of the key ingredients here in the requirements is the need to document it. So you really do need to follow a process, gather your information, and one of the end results of this will be several documents which we'll talk about that should really help you as you go forward. So you want to be looking at things like where's my PHI, who accesses it, and so forth. Next step up, you really want to document what are those potential threats. Susan mentioned some of them, but some of them are simple things. People often look at the things like nature and tornadoes, but it's also a threat is your door open? Do you put PHI, you still use papers, or people leave their laptops open, or do you post information in the office for individuals? You need to be considering the threat of somebody walking in and seeing this. So a lot of it is process-driven too, and you really need to be looking at all these areas. And then you want to look at what do you have in place today, and where are your gaps. So maybe you do have access controls on your laptops, so you're covered there. But maybe you leave your door open to where your server is or where you store PHI, and you need to look at what new control do you need to put in place. So it's really a process of collecting and identifying what my environment is, determining where my threats are, and then what are those controls and remediation activities that I'm going to need to do to secure my organization. So what are the basic steps of a risk assessment? There's a lot of risk assessments out there. ONC has recently put out what they call a risk assessment for the smaller provider. Hopefully some of you have seen it. It is simpler than their initial 800-question risk assessment, but it still has over 160 questions, and it really is comprehensive because it ties everything back. But what you really need to do with any of these tools like that is you need to have a process, and they even mention that this is just a tool, and you need a process. So what we have here is a standard process. This is based on the NIST government guidelines, industry standards. Anybody's familiar with IEEE, but it's basically the thing to think about is here it's based on the industry standards. And if you complete a risk assessment like this, you'll be covered. This is really what HHS ONC is looking for, any auditors would look for, any business partners would look for that you have to have done. So step one, complete a PHI system and application inventory, so understand where your PHI is, all your applications, all your systems, all your networks. Then look at the threat identification. So what are my threats? And really get a full inventory of them and rate them. And what we would suggest here is you want to prioritize this. Unfortunately, most people still are talking about the big bang and cover everything, but you really need to be most effective, and the cost benefit is to look at, okay, what are the likely threats, what are my biggest threats, and prioritize them. Identify where you have vulnerabilities and gaps to those threats. So if one of the threats that you see, as Susan mentioned, is that you're in a floodplain and your office could be flooded potentially, or you couldn't have access, do you have an alternate site to look at? And do you see that as happening? If you're in Southern California, it's probably not very likely. It's not going to matter 1 or 2 days if they have a torrential rain. But if you happen to be on the East Coast or the South, the way the rain has been going, it is something to really be concerned about. So you might put that as a higher priority, that I want to look for an alternative site. Then what kind of controls do I have in place to try to mitigate those solutions? So one of them could be, like I'm saying, that I've determined I have an ulterior site. If one of my threats is that my office is open and people can see laptops, one of the controls I would have in place, do I have the automatic locking of any laptop? Have I provided security awareness training to everybody to understand the importance of shutting down their laptops, having secure passwords, etc., for their workstation? Determine the likelihood, and we kind of mentioned that, based on where you are or the type of thing. I'll use that current one, physical security. What's the likelihood of somebody walking in to an office? Most practices, organizations, pretty likely. So that's something you really would probably want to prioritize if you do not have good password controls or automatic lock-off, or you have not done security awareness training. Determine what's the impact on my business. So what would happen if I did have a problem? If somebody did get into my systems, what would be the effect on my patients, on my reputation, on my practice? That is really very important. I'd say this is the number one reason to be doing this is, what is the real impact on your business? And those that you see as high, you're going to want to focus on. Determine the risk. So taking into account what's the importance to my business, what's the likelihood, what's the gap, prioritize those risks and do the highest ones. And that really should be your plan, because there's a misconception you have to cover all risk. No, that's not true. Anybody who's done Sarbanes or PCI or any of the other type of compliance realize they've moved to a prioritized approach. But what you do want to do is really focus in on those high priority items and get them mitigated and remediated. And then show that you have a plan to hit the additional items that you've got. So what I would say right here, the goal, that last point, is really critical because it's been lost in translation. The key is not just identification or doing a risk assessment, but it's the mitigation of the risk. So it's really resolving them and improving the security and privacy environment and culture of your organization. And that really should be your goal. Not just identification, but mitigation. This is just what a risk assessment looks like. This is one version. As I mentioned, ONC has one. There's a lot of other ones out there. HEMA's done one. The HITECH Group has done one. But the basic concepts are all the same. What these is, you're trying to determine for one of the requirements, are you doing it? Do you have a control in place, and is it a risk? So just taking this one here is, do you have policies and procedures in place? And this is a pretty common one. Most organizations have some, but they don't have a complete policy and procedure. And you really want to then determine, okay, where am I with this? How important do I believe it is? What's the likelihood of it occurring? And you can be as simple as high, medium, or low. And if you look at most solutions out there that can help you, they kind of keep it at that level. That's a great way to look at it. What's the business impact, and then what's my overall risk? And that's really what I'm going for here, is trying to come up with what are my most critical risks that I need to work on. This next one really gets the idea that this risk assessment is stage one. So it's really, we're assessing the organization's compliance environment. How are we doing? But it really is, when you look at this ladder here, it really is just step one. And ONC has recently come out with some guidance to reiterate that part, that risk assessment needs to be done every year. Also, the key part of this is that you need to basically remediate what you find. So a lot of people we talk to say, I'm going to do my risk assessment, I'm going to develop my security, privacy policies and procedures, I'll have a nice workbook or I'll have it online, and I'm done. And that's the farthest thing from where you should be. You should really be thinking on, what do I need to really put into place in my organization a culture that's going to manage the risk, reduce the risk to me at a very affordable process. So you don't need the most complex process, but what you do need is something that you can actually handle, deal with, etc., as you go through this process. So step 2 is really, and as we go down the line in these webinars, we'll be addressing that, is prioritizing and actually mitigating the risk and gaps. So developing your mitigation plan. What activities do you need to do, and then what are the things you need to do with devices? It may be encryption, but it may be as simple as access control. So you really need to tailor this to your organization, your business goals, your business environment, and the type of practice that you are. So there is no one cookie cutter to this, is I think a nice way to put it. You really got to tailor this to your organization. And then lastly, what are we trying to do? We're trying to get an overall governance environment that we can use for the future so we can really have our staff trained, because the biggest misnomer here, and everybody sees it on TV and everywhere else, and every university seems to be focused on cyber security, cyber risk. Well, 90% of the breaches are from human error. They're operational, they're process. They're not hackers. So you really need to get that culture in there of people understanding what's the importance of having a password, what's the importance of locking the door, what's the importance of keeping PHI secure, what's the importance of knowing where my tablet is so that I don't lose it. And that's really the kind of things that you probably need to be focused on. So with that, we're going to turn it back over to Susan for some final thoughts. Please, as she's doing that, if you have questions or comments, please let us know. Susan?
Okay, thank you, Robert. I'm just going to wrap up with a couple slides here, and one of them is highlighting the fact that there is a risk of inaction. OCR has been very outspoken in terms of their assessments in the past have shown that, or their audits in the past, that a thorough risk analysis is a major weakness for covered entities and their business associates. As we know, back in January of last year, business associates got dragged into this world big time, and some of them have gone kicking and screaming. So the same requirements are on them. In thinking about Concentra, the last statement by Bruce Schneier, security is not a product. It's not a project. It's not an exercise, okay, and especially the assessment process. It's designing a strong system, as Robert said, designing an entire system so all your measures work together. All your policies and procedures make sense and they're manageable for your organization. And yes, the assessment is only step 1. So what's next? What comes after that? Well, the other expectation, the next part of that, is implementing measures sufficient to reduce your risk and vulnerabilities to a reasonable and appropriate level. And that catches a lot of people too. What is reasonable and appropriate? Reinforcing again what Robert said, it really depends on several factors. The size, complexity, and capabilities of your practice or your company have a huge effect on what will be deemed reasonable. Your technical infrastructure, what hardware and software security capabilities do you really already have and you're not even using right now? And then, of course, cost of security measures that impact so many practices and companies. So the probability and criticality of the risk to your PHI are also going to be factors that will be looked at in terms of whether you can avert that cost or whether you cannot afford to do that. So first, do an honest and thorough risk assessment, as we've encouraged you to do, so you can come up with a good risk remediation plan and keep marching toward compliance, because it really is a journey. And And that's where we hope you are going and taking this first step toward compliance and reducing your risks. I see we have a couple of questions. Adam, are you going to manage that for us?
Yes. First, I just want to thank Susan and Robert. Those are some very, very interesting insights into this important topic. We have a few minutes left in our time here, and I do want to jump into some of the questions. One question I have, should there be signs placed in the facility identifying if privacy is being protected? And I will open that up to either Susan or Robert, who would ever like to answer that.
I would start off by saying more important is that you actually do have a notice of privacy protections, and you've actually thought about what you need to do within your organization to maintain the privacy of patient health information, and that it is available for the patient so they understand it also. But I've seen more and more practices and organizations posting it because people are asking about it now. Because patients in this social networking world are keen to things like this. So it's a good way to let people know, yes, you are following the requirements.
And I'll just jump in behind Robert. Every lawyer that I've spoken to said it's actually a requirement to post your notice of privacy practices. And in there, you're really identifying what you're doing. There is a model out on the HHS website that is a very nice model, and I think they're very much saying, why doesn't everybody use this? So, of course, you're supposed to be doing whatever's in that model notice, but I think it is imperative that you do post it. One of my clients actually just leaves copies of it on their in their waiting room, but now they've also posted. So I think I would pay attention to that and get it posted.
Excellent. Another question I have is somebody asks, are you able to provide us a good risk assessment questionnaire?
There's a lot of good risk assessments out there. ONC has theirs. We have one that's in an automated, and there are a lot of automated ones available. What we will do is send some links to several of them out to the attendees so that they can access them. We have one that's very simple, and that was the whole concept behind it, was to simplify the approach and really put it in business terms. And from there, you go up to ones that are more complicated. So there's a whole series, and we'll post links to several that you can take a look at.
Another question I have is, who within an organization should do a risk assessment? Should it be one person or a group of people?
Well, I'll start, and then I'll let Susan jump in. You really need to have, and the requirements call for this, and actually because this is a process, you need to have one person who's responsible, because without someone responsible, like any project or any ongoing effort, because this isn't one time, it's very hard to be successful. But you really do need a group of people doing this, because one person normally does not know everything about the organization. They don't necessarily have the skill set for everything, and they need assistance. And it could be from people within the organization. It could be from IT vendors if you have outsourced IT support. So you really need to look at your own environment, who is really involved with PHI, what are the different stakeholder groups, and try to get at least one member from that involved in the process. But normally, like any project or process, you do need to have somebody who is the leader, and that is one of the requirements, too, is that there is a security privacy compliance officer in the organization.
I'd agree with Robert. Yeah, I would agree with Robert. This is probably not possible unless you're a one doc, one person office, and even at that, you've probably outsourced quite a bit to really manage this on your own. You'll get into some technical questions on that area of the assessment, and you're going to want expertise to handle that. Again, if have never done a risk assessment, you might want to look for help in doing that the first time at least, and get with somebody who's going to transition that knowledge to you so that you can handle it in the future. That would be my recommendation.
And then I will just add the recent ONC guidance, matter of fact, they honestly state that they do recommend that most organizations utilize some assistance, as Susan mentioned, for technical errors or overall guidance or quality assurance to help put them along with the process.
Thank you. I'm going to jump in because we have exhausted our time on this webinar. Unfortunately, we did not get to all the questions that we received. Something tells me that this is a topic we could probably spend a little bit more than 30 minutes discussing. But just by way of announcement, this presentation has been recorded, and we will post that recording and send that into an email to all those who have participated, as well as a copy of the slide deck that we were using today. In there, I will include my contact information as well as Robert and Susan's contact information, and they have expressed to me that they would be happy to field additional questions offline if anybody has those. One last point, we have, as I mentioned at the outset, this is the first in a webinar series, and our next webinar in the series will be titled How to Build and Implement a Remediation Plan. So if you think about it as a process, as we've been touching on today, kind of step 2 after the risk assessment is the remediation plan. And that is on May 21st at 1 p.m. There's a link on this slide in which you can register, and that link will also be included in the email that you will receive subsequent to this presentation. One final time, I want to thank Robert, I want to thank Susan for their insight and their time. I want to thank everyone who was able to participate, and we hope you will join us again on May 21st. Thanks a lot to everybody. Have a good day.
Thanks, Adam.